So welcome everyone to our infant feeding introduction to solid foods. I'm Michelle McDonald-Werstack, a dietitian and a nutrition groups coordinator with the Hamilton Family Health Team, and I'm here with my colleague Jacqueline.
Hi there, my name is Jacqueline Adler. I'm also a registered dietitian with the Family Health Team, and I'm the nutrition program coordinator here as well.
So today, we're going to talk about some of the questions we've been getting from our patients during COVID. We've been doing a lot of phone counseling with our patients, and we always are trying to provide that nutrition information that you're looking for. And many of our patients have questions around infant feeding. So we thought we would do a webinar that would give you a few highlights on some of the common questions that we're receiving lately. So we're going to focus a little bit today on things like what are some of the key nutrients for optimal growth during infancy, how to introduce solid foods to your baby, what are some of the myths and misinformation you might hear about infant feeding, and we're going to touch on food safety, managing constipation, and more. So one of the common questions we get, and this is probably the most common one, is when should I introduce solid foods to my baby? So really what we want to be doing is waiting till baby is ready, developmentally ready, to be able to take food in safely and have that ability to have that head control to sit up, to actually accept food and turn their head away to tell you when they're full. So that happens somewhere between 4 and 6 months. Every infant is different, and so that as a parent, you're trying to look for those cues to tell you when is your baby going to be ready. So signs of readiness are things like sitting and leaning forward or backward independently. They'll follow or track food with their eyes. They may be watching you eat. They'll open their mouth wide when offered food, and they can hold their head up and turn towards and away from food. So the other question we get a lot is around iron. So iron is one of the key nutrients that's so important for infants, for all of us actually, but especially for infants around 6 months of age, because the iron stores that babe has received from mom during pregnancy, during that last trimester, the iron stores are now depleted, and that's when food sources now have to be the source of iron. So at 6 months, the iron stores are gone, and now we need to switch to iron-rich foods, and this is the time to start to introduce those foods to your baby. Babies that are nursing breast milk and all milks do not contain iron, and so we need to make sure other foods are offered to contain a source of iron. And we want to start small with small amounts of iron-rich foods. We usually start once a day, and then we work up to twice a day, gradually increasing up to 3 times a day. So what are some of those foods that you can introduce that are a good source of iron? Well, iron-fortified infant cereal has been around for a very, very long time, and it is an excellent source of iron for infants because it is fortified. And so this is something that many people do start with, a couple teaspoons at first of iron-fortified infant cereal. Now, there's other foods as well that contain iron, such as your meats and your meat alternatives. Some of them are listed here, as well as foods like tofu and legumes, so your beans and lentils and chickpeas. So these are foods that can be easily mashed and softened, and they are a very good source of iron. So in terms of how to introduce solid foods to your baby, we talked about this a little bit. You can introduce in any order. There's no preferred order anymore. There used to be this order of vegetables first and then fruits, but that is not something that we follow anymore because there's really no scientific evidence behind that. Usually we'll start with an iron-rich food once and then go to twice a day. You may start with a couple of teaspoons at first, work up to 2 or 3 tablespoons. Again, babies will be giving you cues on how much they can actually eat. And if you're starting with a cereal like an iron-fortified infant cereal like rice cereal or oat cereal, you usually start with 1 grain at a time, and you're trying to go slowly because there's no rush in introducing these solid foods. You're really trying to gradually introduce a variety of foods to your baby over a series of many, many months until they transition into sort of family foods at 10 to 12 months of age. You want to continue to give breast milk with a vitamin D supplement because, again, vitamin D is a very important nutrient for optimal growth, and babes need to be having a supplement until they're able to consume enough cow's milk to give them a source of vitamin D. And still, some of the newer evidence is showing we probably still need to supplement as well then. We want to delay cow's milk at least until the baby is eating a variety of iron-rich foods. So that's somewhere usually between 9 and 12 months of age. And in terms of allergenic foods, we're going to talk a bit about that on what's the best way to introduce those. So how much should my baby eat? Again, this is very individual depending on your baby, and your baby is going to be giving you cues, telling you when they're full by turning their head away. They may push the spoon away. They might close their mouth and decide, that's it, I'm not having a bite more. And that's your cue that they're full. So as we mentioned, you need to start very small, 2 to 3 teaspoons at a meal, and gradually working up to 2 to 4 tablespoons per meal of an iron-rich food. Again, you're trying to start to build baby's day into that 3 regular meals with a couple snack periods. So you're working towards 2 or 3 larger meals and then 1 or 2 smaller feedings. In terms of textures, this is a transition. So we start with very, very soft, easy to swallow textures. And then as baby gets accustomed to the food in their mouth and that ability to swallow safely and move food from the front of the mouth to the back of the mouth safely, we start to transition different textures. We're going to pureed, then it goes to lumpy, then to ground or mash. So for example, you might have very soft baby food texture when baby is at 4 or 5 months, but as they transition to 8 or 9 months, 10 months, they're now being offered, say, a soft potato, crushed with a fork on their serving tray, and that may be fine. You're moving to pieces of soft cooked food. You want to offer finger foods because this is a really important time for baby to be able to use that hand-eye coordination and reach out for food like a piece of toast, or perhaps something soft like a cut up banana that they can actually pick up with their fingers, bring to their mouth, and start to investigate this food because this is a learning curve for them. And smell and taste and texture are all part of that learning for them to really be enjoying some of the different foods that they're being introduced to. And another issue to mention is teeth. So a lot of our parents will say, well, my baby doesn't have teeth. Can they have textures? And yes, they can. Their gums are very strong, and the baby does not need to have teeth to advance from a pureed to a lumpy or ground or mashed food. So when is my baby ready to drink from a cup? So usually at about 6 months of age, baby is ready to start learning how to drink from an open cup. At 9 months of age, you can start weaning your baby from the bottle, and by 1 year, hopefully, you can celebrate being bottle-free. That may not always work out. Again, it is a bit of a transition, and that's one of the things that as dietitians, we may be able to help you with some of the tips to help with the transitioning, because sometimes we run into a few challenges that parents report, but there's always a few strategies to work around. So sippy cups, which many people may use, are easy to prevent spillage, which parents love, but they don't necessarily help a baby learn how to drink from an open cup. So it does take practice. So you may want to start with a little bit of water and practice so baby can get the feel of having an open cup. Again, it does get a little messy, so be prepared for having a bib or having a few towels around to sort of mop things up because it can get a little messy. So safety. So this is a big concern for parents, and rightfully so. We really want to ensure that while children are eating, that they're safely eating. And number one is to never leave baby alone while eating. So you always want to be in the room to be able to watch and observe and see how they're doing. You want to make sure that the food texture is appropriate for the age. So again, starting very pureed, soft foods, and baby is sitting up properly, so not slouching back. And you want to avoid some of the foods that can be quite hard and can get caught. So things like carrots and grapes and hot dogs, these are all things we recommend people cut. They cut, so it's not a circle, we cut them in quarters and fine pieces. So these round foods that are quite hard, we do want to avoid those because they can be a choking hazard. Again, really important, babies are just sitting in the chair, they're not crawling around, you're not running after them with a spoon, so you want them sitting up so that they can pay attention to the food and eat safely. In terms of food exposure, we do recommend no honey before the age of 1 year. So in terms of allergies, are there foods I should avoid giving to my baby to prevent an allergy? So the good news here is the Canadian Pediatric Society has now put out recommendations saying that introducing foods like egg and peanut butter at 6 months, even in infants who are at high risk for allergy, so infants from families that have multiple allergies, there does seem to be this window of opportunity that we want to be introducing these common allergens, and introducing them at that time seems to be associated with less allergy, which is good news. So we want to introduce some of these things in very small amounts. We want to wait 2 or 3 days before introducing another new food to assess for any reaction. And of course, this is something that dietitians can help you with, because I know for many parents, this is quite an alarming thing. They're very worried about this, but we can definitely help walk you through how to do this. So I encourage you to reach out to the dietitian in your family doctor's office, and they can help you with sort of how to do this. And lastly, when can I introduce cow's milk to my baby? Again, a very, very popular question. We've already mentioned this briefly, that between 9 and 12 months of age is usually when we would recommend introducing cow's milk, after the baby is eating a variety of solid foods that contain iron. Again, babies tend to fill up on milk. They love milk. It's easy to swallow, and we sometimes get what we call milk babies. All they want is milk. But we do worry about the iron, not getting enough iron if they're consuming too much milk and not enough iron-rich foods. So when it comes to introducing cow's milk, offer homo milk from an open cup. Again, homo milk is 3.25% milk fat, and that's important for babe's brain growth. And goat milk is also suitable if it's pasteurized and fortified with vitamin D and folic acid. And now I'll transfer it over to you, Jacqueline.
Okay, thanks. One of the questions we do get a lot is around other milks, so alternative milks that people maybe prefer not to give cow's milk. And so they want to know about the alternatives like almond milk and soy milk. In fact, we would say that at this age, before the age of 2, the plant-based milks are not appropriate. They don't have enough fat in them for, as Michelle mentioned, babies need that high-fat diet for brain development, and it's a really crucial time in their development. So they do need that extra fat from cow's milk that it does offer. Goat's milk would be the alternative. If baby can't tolerate either of those, then we would say formula is something to stick with, or breast milk is something to stick with until they're 2, and then can transition to whatever milk you choose in your household. So things like almond, rice, coconut beverages, while they may have adequate protein and other nutrients if they're fortified, they just don't have that fat that we need the baby to have. So another question, how often does my baby need to eat? I get this question all the time. Babies have really tiny tummies. So you may think that, you can offer a certain amount and they're fine for a few hours, but they probably need something about every 2 hours. So that 3 meals a day, 2 snacks a day, maybe 3 snacks a day is a good goal to get to by offering something every 2 hours. So don't worry if they're not eating a ton at every opportunity, because you'll offer something again pretty quickly. So this is something we call the division of responsibility, and this is something that instills that trust between you and baby, and them trusting their own bodies to know when they're hungry or full. And so when introducing solid foods, we'd say that the parent or the caregiver is responsible for what kind of foods the baby is going to be offered, when the food is offered, and where the baby is going to eat. And then we leave it up to the baby to decide if they're going to eat and how much they're going to eat. So paying attention to their cues that Michelle mentioned earlier, if they're still reaching for more and looking for more, you're going to give more, even if you think that, the bowl is done. If they're done halfway through and they're pushing it away and saying they're finished, then you're going to respect that and allow them to be done at that meal. Again, you're not going to worry too much because you're going to offer something again within 2 hours. Is organic food better for my baby than conventionally grown food? I would probably say no. There's no significant nutritional difference. There are still organic pesticides if that's what you're worried about. And so you may think about choosing the lower pesticide foods more often and offering rinsing and washing those high pesticide foods a little bit differently or a little bit better. So, Or you may, if that makes you feel more comfortable, you may buy the organic version of those high pesticide foods. But regardless, we would say that each one, it doesn't matter, each one is safe. What is baby-led weaning? This is a very popular approach to feeding right now. It's an alternative. It's another approach to starting your baby on solids. And we would say it's sort of the alternative to spoon feeding and purees. So it's getting a lot more popular for many reasons. The idea behind it is that it allows baby to self-feed right from the get-go. So from usually around 6 months rather than 4 months, people would start on baby-led weaning. And as long as you are offering soft cooked foods, they're finger foods and sort of finger length, so baby can hold on to it and also get it into their mouth, this would be allowing them to sort of self-feed. There's some advantages that people would say to baby-led weaning. It allows your baby to self-feed. They're sort of in control. They get to join the rest of the family at the meal. It may be linked to less picky eating and acceptance of different foods. It may not, right? Sometimes it's baby dependent, but some proponents would say that that is one of the key benefits. It is considered a little bit more enjoyable, especially from the parents' perspective, because they get to enjoy foods together, they get to eat together, and less expensive because you're not buying separate foods for baby. They're just joining you in the foods that you are eating yourself. There are some disadvantages that we like to point out though. So there's a potential for poor growth, or because they're just not eating as much as a baby that is spoon fed. So leaving it up to the baby, they may just not get as much energy into them, leading to some slower growth. There's also the potential for poor iron intake. Remember, those foods that contain iron are the meats, legumes, beans, and they may not be the most palatable to baby to just eat a big chunk of meat. So if they don't get as much into them, again, there's that potential for poor iron intake. There is no evidence that baby-led weaning increases the risk of choking. So as long as foods are prepared appropriately, babies can actually choke on purees. So that shouldn't be a reason to sway away from baby-led weaning. It just simply depends on your comfort level and what you would prefer. The rule of thumb in terms of preparing food safely for baby-led weaning would be to have it like a finger length piece of food. As well, if you're going to offer a vegetable or a fruit, it has to be cooked well enough that you could squish it between your 2 fingers and get all the way through. And then you know it's soft enough, the baby could handle it. So how do I start baby-led weaning? You would do the same thing as you would with purees. You would offer iron-rich foods at every meal. For example, strips of chicken or tofu, pieces of cooked fish, cooked beans and peas, wedges of hard-boiled eggs. You're going to offer soft cooked cut up finger foods, for example, ripe banana, and so the baby can grasp it. And then you'll just let baby feed himself or herself. So this means they get to decide how much to eat and then what to eat from what you offer. I will point out, just before we actually move on to the constipation, there is that a lot of people who do believe in baby-led weaning believe that it's offering a better relationship with food and baby's in control. I would like to say that you can offer that good relationship with food and help baby develop those internal cues for hunger with whichever method of feeding you choose, right? As long as you are respecting baby's cues, as Michelle mentioned earlier, and responding appropriately, you can certainly foster that good relationship either way. So I often recommend a combination because it allows baby to self-feed. Then you also know if you're worried about growth or iron intake, you can also give those foods yourself. So constipation. We often get a lot of questions about constipation. So constipation is very specific. It means that the baby is not having a bowel movement as often as they normally. You may see a change in stool color. It may be very soft. It may be very hard little pellets, and they're struggling. Look at that baby. She's not looking very comfortable, right? So this is very common when we start to introduce solids. Their stool will change. It's not always constipation just because they're not having a bowel movement every day. But couple of the strategies that we encourage are increasing baby's fluid intake, for example, more breastfeeding, offering pureed fruits, specifically apples and pears and prunes can help with constipation. And then offering, you know, constipation recommendations in that early days would be boiling water for 5 minutes, allowing it to cool, and then giving the water a couple of times a day. Maybe you make their cereal a little bit more watered down so that they get a little bit more liquid into them. So we always want to identify nutrition issues early. That's why we try and encourage those appointments between the 4 and 6 month well baby visits. Introduce yourself to the dietitian on your team, get to know them so that they can help you navigate this new phase of life. And you can ask lots of questions. And then oftentimes we like to check in again at that 9-month visit to see how they're going. At 9 months, we do like to make sure that baby is transitioning well into different textures, making sure they're not solely still on purees. And so if they're, every baby is different, and sometimes babies take a little bit longer to transition, but we have a few strategies that we can help to make sure that that muscle development is coming along well. So earlier intervention and education always sets you up for success and can help reduce the tendencies towards picky eating. If you have any specific questions, you can always email us at the Hamilton Family Health Team on our website at hamiltonfht.ca. You can book a phone appointment with your family doctor, your dietitian, your nurse at your own practice. And of course, you can always join us on these webinars. We are offering them regularly, and we'll offer new information each time. Other resources that we would highly recommend would be dietitians.ca, unlockfood.ca, which has lots of nutrition information and recipes, and beststart.org has a lot of information on starting solids. So we always like to start I always like to look at some polling questions so that we can see how we can do better each time. So I'll just launch that now, and I would love for our participants to answer those if you have a second. And while we do that, we can answer some questions. Right, Michelle? Oh, Michelle, you're muted still. So I have a question from our audience. One of the questions is, I am formula feeding. Should I transition to a stage 2 formula? My baby is 6 months next week.
That's a good question. So stage 1 and 2 formulas are sort of a slightly tailored difference in the nutrient composition, but really you could, if the baby's eating other healthy iron-rich foods, so other solid foods, you could transition to a stage 2 formula. It's also quite safe to stay on a stage 1 formula. It has a little bit more calories and may fill baby up, so they may not be as interested in the solid foods. So that's something that, again, it's a transition. So you may want to start to introduce the solid foods as baby's starting to eat more of those, then go to the stage 2 formula. Jacqueline, did you want to add anything there?
No, I think that's great. I think I usually would just say, you know, don't worry about rushing it too quickly. Yeah. If you still have a bunch of the stage 1, finish it off and then move on to the stage 2.
I know. For
that reason of the extra calories, that maybe it would open up their appetite a little bit for solids, for sure.
Right. And it is expensive. Formula is expensive, so you don't want to be wasting any. Yeah.
No, never waste it.
I have a question for you about baby-led weaning. So people are always wondering, how do I get started? What would you suggest? What would be the first thing you'd want them to do?
In terms of starting baby-led weaning, that's a good question. I always say, like, you can just start with whatever you are having. I find sweet potato to be a really easy one to start with for either one. So if you wanted to do the pureed version, you could do, obviously, you know, bake it and mash it all up and puree it down. But you could make it into fries and just cook it really well. And The key that I find really important with baby-led weaning is that they have a handle, and then there's enough that they can get into their mouth, because baby can't do this yet. They can't open their hand at 6 months to get the food in their mouth, so they need the handle.
Yeah, that's a great idea. They love sweet potato. In fact, I've had several infants sometimes love sweet potato and carrots so much so they start to turn a little yellow if parents are giving sweet potato and carrots over and over and over again. So another reason to introduce a variety of color when you're introducing them of those vegetables, because they do tend to love sweet potato, but they can go a little yellowy, little orange. They're getting too much.
They can go a little bit overboard for sure.
Yeah.
And one of my favorites also is tofu, because babies tend to love it. And again, you get the firm one. It's rich in iron. It's rich in nutrients. You get the firm one, and also just cut it in a long strip that baby can hang on to.
Yeah, it's a great handle. I mean, the other piece around baby-led weaning is always the iron. And one of the concerns is if people are offering fruits and vegetables all the time, they're wonderful for vitamin C and other important antioxidants, but they don't have a lot of iron. So it's really important that iron-rich foods are also offered. So when you're offering that, piece of broccoli at the meal, that you may offer also soft pieces of chicken that they can actually, start to nibble on as well, right? So trying to get that iron source with the fruit and the vegetable. Do you have any tips there for people?
Just sort of continuing to offer the variety. A lot of kids love the beans too, so you can just mash them up, and that may be a little bit later because they have to be able to get their finger and their thumb together to pick that up. But just continuing to offer variety. That's one of the reasons that I find the purees a little bit easier, because you can mix them together and know that baby's getting, you can mix like shredded chicken in with the sweet potato or cooked vegetables, and they know that, then that they're getting it a little bit easier. So just depends on the baby.
It does, and that's another tip I give parents, is to try to keep a little bit of the iron fortified infant cereal, because it's so high iron fortified that even getting 3 or 4 tablespoons that every day is a significant source of iron for babe. So that's a nice compliment too. I liked your suggestion of part spoon feeding, part baby-led weaning.
Yeah, one of my tricks with the baby-led weaning to make sure they're getting iron with that cereal is to make it into pancakes. So you can make regular pancakes and then add the iron fortified cereal to it for flavoring, because they come in all different flavors. And then baby feeds themselves the pancake. And they're getting iron. So
yeah, and they love that. They love pancakes.
Love it.
It's the rare baby who doesn't like a pancake, that's for sure.
Everybody likes pancake, yeah.
Do we have any other questions?
One of the questions that I see is, when can I offer baby water?
So that's where it's changed. The recommendations have changed over the years, depending on when you've had children. But offering a couple ounces of water each day as babies over the age of 4 months is fine to do. Many times in hot weather like this, you may have, I know some people still use sippy cups with water, for example, when they're out and about, or an open cup with a little bit of water. I mean, water is an important fluid, very important for helping to keep the stool soft and prevent constipation. But at the same time, we don't want so much water that it's displacing the intake of other nutritious foods that have nutrients and calories, right? So that's the fine line with the water usage. So I usually say a couple ounces a day. As baby gets older, they may take more than that, but you're just trying to make sure that they're also getting their solid foods and their breast milk or formula.
Right. Yeah. I usually say at 6 months, we're safe to give water, that's unboiled and fine. Before that, you still kind of want to be a little bit hesitant, just because their gut is so immature, right? And so maybe you offer it with a meal, just so that they get something to wash it down. But in between, they're getting breast milk and formula, so you're prioritizing.
Yeah. I mean, that piece about gut health is another important piece. And yogurts, for example, and some of our fermented foods, yogurts and kefir and buttermilks, for example, as buttermilk would be later on when baby is 10 to 12 months of age. But yogurts are something that can be introduced. Again, not a source of iron, so you'd still have to introduce the iron-rich foods, but a very good source of probiotics and good, healthy gut bacteria.
Babies love plain yogurt too. And you can use it with baby-led weaning, you can use it as a dip. So if you take the banana and you allow them to, it gets very messy, but if you allow them to just sort of dip in the yogurt, it's a great way to get some calories into them too. If they can have that super high fat yogurt, the 6%, 11%, and it's,
Yeah,
I love it.
and high protein too. I mean, and
Yeah,
that piece about getting dirty, I'm glad you brought that up because that's an important part of learning about food. So kids need to be able to touch and feel, bring it to their face.
yeah,
Sometimes it doesn't hit their mouth. Many times it's all over the place. And sometimes I've had parents that are very worried about keeping the baby clean and so hesitant to let them sort of really get into the food. And I really always encourage them to really let baby try to self-feed. It will be messy,
sure.
but that's part of learning.
Yeah, yeah, for sure.
Yeah.
Yeah. Let's see.
Do we have any other questions?
I think that's about it.
Okay.
Yeah. So this was fun.
It was. So we want to thank everyone for joining us, and we look forward to you joining us again. If you're interested in other workshops or webinars, please go to www.hamiltonfht.ca. We have an events calendar under our groups, and you'll be able to see all of the sessions that we offer, both nutrition sessions, mental health sessions, as well as physio. So we encourage you to join us again.
Thanks for joining us. Have a great day.
Okay, have a good day. Bye-bye.